You are listening to the Fitz and Healthy podcast. I am your host, Dr. Lauren Fitzgerald, also known as Lauren Fitz. I'm a medical doctor, a fitness instructor, an entrepreneur, a health and fitness coach, but most importantly, I am a lover of life. And here on the Fitz and Healthy podcast, I intend to give you a ton of great information and knowledge that will serve as potential power so that you can live a life by design and make it more fits and healthy. And don't forget to listen to the disclaimer at the end. I'm not your doctor, yo. All right, enjoy the episode. Much love. Ciao. Hello and welcome to the Fitz and Healthy podcast. My name is Dr. Lauren Fitzgerald, and today I have an extra special interview with you guys, for you guys, because this chick, not only is she an author, a physician, an anesthesiologist, and a pain doctor, but she was a mentor to me when I was in medical school and residency. And also, we tended to work out every now and then together as well because we were both into fitness. So Melissa Cady, Dr. Cady, thank you for joining us today. I am so freaking excited for this interview. How are you doing today?
I'm good. It's been a crazy day, but I'm very glad to be here, and I'm so honored that you put me on your podcast.
So tell the listeners real fast how your morning has gone down.
You know, you realize sometimes something's unhealthy, like your lawn.
Uh-huh.
You need to add some good foundation, some good compost. And so I had a whole truckload of compost this morning that my husband and I are personally having to shovel around our entire yard. And it is a lot of work. So if you have a little extra change to have someone else do it, it'll save you from overuse injuries and further pain. So just a suggestion.
And see, this is why I love you, because we're both like-minded. We could easily pay for it, but we're both very hard workers, and it's a good chance for exercise. But then you get in the middle of it, and you're like, oh, and the S-bomb would come because it's a bunch of S-bombs everywhere in your front yard.
Yes.
So the listeners and the audience don't understand our connection. And so I want to recap who you are to me, and so that they have an idea, especially the people that are listening on podcasts. So Dr. Cady, I knew her as Melissa because I was a med student when I met her. And she is this beautiful brunette with curly hair. She's always been in really amazing shape. She has veins that literally, I always joked, I could probably like blindfold, put an IV in from across the room. Your veins are, I assume, still as awesome as they were back then, right?
They're big. Yeah.
But it's because she's in such an amazing shape. And she and I were two of the few people really in our entire residency program that were actually into health and fitness and took time to exercise, go to the gym, and take care of our health throughout a time in which many training physicians put their own health aside and don't take care of it. And so I immediately had respect for her on that aspect. But then she has this amazing work ethic that literally she cared about teaching the med students. And then I became a resident. She was still a resident when I was a resident. And every chance that she had, she has a work ethic like people you just don't see nowadays. And so I have a respect for her in such a way that I just can't say enough good things. And she happened to write a book. And she actually, looking at the book that you sent me, you sent it to me. It was dated 4 days after my knee surgery. And I don't know if you realized that at the time, but my knee surgery was actually December 22nd, 2015. And you sent it to me a little bit after Christmas, right after my knee surgery. So, and I didn't read it at the time. I really wish that I would have read it then. Because I've learned so much. I listened to the audiobook. Man, it's such a great book. So my first question to you is, what made you even want to write this book? Because that's not typical for people in your position.
No. Well, first I want to thank you for saying all those nice things, because I do a lot what I do because it just feels right, and I don't always realize how people are perceiving me. Um, I think my husband actually really has reminded me of how much I always work, which is a big challenge for me, to always try to learn how to just, chill out sometimes and actually enjoy myself and be in the moment. And so we all have something we have to work on, and that's more of what I need to work on. But to answer your question, there's just so many times that I would get frustrated with, let me just back up a little bit. I essentially went through all of my training, finished pain fellowship. It's a 1-year pain fellowship after your 4 years of anesthesia, as you know. But for the listeners, most of the time you go straight into a pain medicine clinic, you do traditional pain medicine. And I was a little bit just distraught with the way that I was seeing how a lot of the practices were being run. And so when I knew out in the private practice, people were changing maybe what they did for the patient because maybe the reimbursement was better, or, I hate to say it that way, but there were things that just didn't make sense. And I'm an extraordinarily logical, rational type of person.
I remember that about you.
Yeah. Like, if it doesn't make sense, like, why are we doing that?
Yes.
And especially when it comes to somebody's health. And so I just got to the point where it's like, I felt nauseated about the idea of joining a traditional practice. So I said, I'm just going to do anesthesia. And of course, we don't make much money as a resident. And less than a teacher salary at times, if you really look at it. And so I was just like, I'll just work 3 or 4 days a week in anesthesia. I'll figure out what I want to do. And in a few years into it, I realized, it was actually one particular person that probably made me think about a book. And I met this older gentleman who was fairly fit, talked to him for a while, and realized his father, who was like 90 years old, was extraordinarily fit, and they just are committed to being active. And I've always loved that, when I just see people they keep doing what they're doing and they keep their function up. And so when I kept talking about my passion, and he was very inquisitive, he was like, you should write a book. You should you have a message. Why don't you get it out there? And
that gives me chills. That's so true. Yes. Yeah.
So like Chalene Johnson, he mentioned Brendan Burchard. And so all these, it just really feeds me because I love self-improvement stuff. And,
another way that we're
yes,
like-minded.
Right. And I think it's also a byproduct of being in medical school, or just being in any kind of training where there's this expectation of more and more. You got to know. It's about knowing. And so there's a little part of that where it's like you never have enough. You always want more information.
Yeah.
But there's also that part of you that knows that you want to contribute more and you want to have more impact, and you can't really be a better leader. So that was kind of one of the things that made me think, the light bulb went off, and I said, I'm gonna look into this. And so I basically hounded a hybrid publisher and went to their weekend thing and pitched my book. And 2 months later, I basically was accepted.
No way. That's awesome.
Yeah, you could talk to the guy with Chicken Soup for the Soul. He had to go to like tens to hundreds of people to finally get that approved or get it, accepted, I should say.
Right.
And so that's really what it came down to. And on different flights, I would write down in a journal. I'd get this just powerful feeling about things, and I would just start jotting it down. And it was just in different times. And I get a thought, I hear someone say something, and it's like a pet peeve, or I just like the emotion of, I'm like, dude, you guys need to know this.
Yes.
So I just put it all down, and that's how I ended up writing the book.
So is it a book that you give your patients now on a regular basis?
Well, that's a little tricky.
That's what I was wondering.
I'm in anesthesia, and I work as an employee.
Yep.
And so because I work as an employee, I've run into situations where, I've done multi-level marketing type businesses in the past, and I genuinely just want to help people, and I'm passionate about it. So sometimes it comes across the wrong way. And so even my own colleagues were like, you might need to shift how you do this, because it's
painful.
Conflict of interest stuff. And but the funny thing is, it's really not a conflict of interest when it comes to helping them. It's just if you get something from it, even though you virtually make little to nothing when it comes to a book, unless you're just, Oprah or someone like that, you're not going to make, or you get a big, huge forward of money.
No, you don't do it for the money.
No, this is for a message. It's for helping people have perspective. It's not going to say this is the answer to all your problems. It's more like, I'm giving you about 10, 15 years, 15 plus years. I have to think about that. Close to 15, at least 15 years of medical experience and perspective that really is going to give you some insight on how you should really approach things. And it's just real rational. It's not going to tell you the answer straight up, but it might make you think about some things a little bit differently and avoid maybe $100,000 surgery that you don't need, or use it appropriately.
It's interesting because I remember when I knew that you were going to go into pain, having a thought, because you are your moral level is so high. And I know that, well, let me just back up to a story. And I don't know if you remember this, but there was one, I don't even remember what I did, but I was having major pain in my back, and it was on call, and I think you were the chief resident on call, and it was in between cases, and you literally, I was on the OR table, and you adjusted me, and then I stood up, and I'm like, oh my gosh. And that was kind of my first evolving into believing that maybe, this alternative medicine stuff isn't just all woo woo, and maybe the whole, the practices that like acupuncture that have been done for a long, long time, maybe it's not just a bunch of crap. Maybe there's something to it, and the whole adjusting and whatnot. But I know that in medicine, in the business of medicine, like you talk about, which I love, the explanation of the conflict of interest with business and medicine is just brilliant in the book. But it's not always the most money making deal, and I wondered how that affected you as a person, because I know you as a person, and I know that so many alternative methods that don't make a lot of money but can help the patient, and what kind of conflicts you've had in your own practice of pain.
Well, and the funny thing is that I don't have a traditional pain clinic, but I help a lot of colleagues and family and friends. And what I do discover is that, being an employee right now, it always makes it tough, but I'm pretty outspoken about it. And I do feel like there's way too much volume and repetitive injections. There are always going to be these rare traumas and rare circumstances where people, do the best they can, and they are bridges, but they keep having to repeat the bridges. But what I find is happening a lot is that there's just such a high volume. When you have 20 plus injections in one afternoon for one particular, pain physician, but yet they keep coming every 2 weeks, and you see so many issues and this is how I find out that they're not doing anything else. I don't try to impede on their relationship, but I feel like when I hear a lot of nurses trying to explain to the patient that doesn't even understand what they're just about to get, and they're not even pain nurses.
Yes. And
they're explaining, well, hope it fixes you. And I'm thinking, psychologically, why are you setting people up for it like that? And the point is that these are treating symptoms, which is fine if you've tried everything, or our system really genuinely has not found the answer, But the problem is, I'll ask the patient, I'll say, so, what other things are they teaching you to do for yourself? Or what are some other things that you're doing in addition to the injections? And I can't ask every patient, but there's times where I have that time, or the patient is really just confused and they don't know what to do. I might give them some direction in the sense of, maybe you should just chat, make an appointment. It's okay that if you want to see the physician, not just the PA or and somebody else that's not really the physician making the decisions on this protocol.
Right.
I say it's okay to make an appointment with them, and it's okay to ask them questions. You should understand what you're having done. Doesn't mean you have to understand every single thing, but you should have a concept as to, what are we treating?
Yep.
why are we doing it this way? If it's not helping, why?
Mm-hmm.
What are the other things that we can do? So I really just want to empower people to realize, first of all, you should understand some rationale. There should be a rational explanation.
Right. But there's not.
No. So my biggest conflict here is the lack of education.
Yeah,
so,
the know your home concept, like it's so true. It's amazing. I don't know if you knew this, but I did anesthesia in a pain clinic every Tuesday for like a year. So I got firsthand experience, and like the part where you're talking about in the book, how essentially there's no reason to need anesthesia, but this is another way that they can bill and make money.
Right.
And I mean, I was a part of that system. That's why I got out of that system, because it was a conflict to everything that I know and stand for. And it was just amazing to me how, and I would see the same patients every 2 weeks. And so they'd get to know me. I kind of liked that part, because you don't get that really in anesthesia very often, but it was amazing to me, their lack of understanding of the whole disease process and how quickly they were put on opioids. Your chapter about opioids is, like spot on, but it's disheartening. I'll tell you, I'm not officially the medical doctor for people that I coach and are my customers, but I have a lot of people that ask me for unofficial medical advice, and I give unofficial medical advice. And I've helped a lot of people wean off of opioids because they didn't realize that was an option. They thought that they were going to be doomed forever. And it's just, the system is so messed up. So let me ask you, top 3 things that you wish you could change from the classic pain patient that comes in, that if you had a magic wand and you were like, this could change, what would those 3 things be?
First of all, that pain is typically not life-threatening, and that patients need to recognize that they need to try to basically they want to rule out the red flags.
Yeah.
You just kind of ease your fears of just ruling out major red flags. And I mean that like as in, cancer or a major bleed around the spinal cord or whatnot.
Which I thought you did a great job covering the major things that they should be worried about, for sure.
Right.
And I love the fact that you said people's misunderstanding that the spine can just collapse. Like, I think that's a common thing, but I just love how you cover that.
Yeah. Well, thanks. Yeah. And the thing is, when I say to not consider it life-threatening, it's about the fear.
Yeah.
It's about the fear factor too. If you don't learn to try to understand things, then the fear builds. It's just like anything in life. And I know this sounds totally unrelated, but if you're from another country and you see someone else and you have a stereotype and you don't understand them, there's a huge fear. Yep. And so it's just embedded within our DNA, the way we are, that if we don't understand something or something's unfamiliar, then it's very scary. And so you'll tend to frighten yourself internally. And so trying to learn to get some education, try to understand if there's something to really be worried about, and just keeping your system calm is going to help you. Because if you let yourself get overly anxious, overly worked up about something, your pain will get worse. Absolutely. You're self-feeding that cycle. And so that's one thing, is to try to rule out the red flags, try to maintain some calm despite the uncertainty. And the other things are kind of put me on the spot here, but this is,
I know.
these are good things. So that's, I think, recognizing that it's not always a quick fix.
Yeah.
And that there's a process. And most people that go through pain that's persistent, and we could call it chronic acute pain, that doesn't help you understand your pain at all. But it's a process and a journey, because if you're not really in tune with your body to start off with, then trying to understand why this pain is there is going to be even more confusing. Mm-hmm. So that's why sometimes you need more than one person or different people. If you go to a pain medicine physician, they know how to inject. They most of the MD anesthesiologists that you meet are going to be essentially very procedure oriented. Unless they were trained, and you don't know, they may be trained in a very multidisciplinary approach, and they have a very open mind to consider other things. And most people genuinely are wanting to help the patient, but they only have certain tools. And so you get very siphoned into those specific things. So you got to realize that there is a journey involved, and that journey involves you understanding your body better, knowing what makes your pain better or worse, having somebody that's trained in multiple things. It depends what kind of pain it is. If it's inflammatory pain, true inflammatory pain, the problem is not all pain is inflammatory. It could, you could be working in the garden or hauling a whole bunch of compost around your house. Let me just loop that back around. You could be throwing compost, and if you keep doing it the same way, like, let me just tell you, this is one way I try to avoid pain, is like, I was throwing the compost one way. Well, I need to do it the other way. I'm trying to avoid an overuse injury.
Right.
So, and then I slow down the speed, higher speed, higher velocities, those kind of things too. So learning how to understand your pain, this whole journey, it takes time, and people need to understand that, because unfortunately, I mean, there are persistent pains that, it takes years or decades for some people to finally get a hold of it. And they may have gone through 3 or 4 surgeries before they learn the hard way, So the third thing, first, it's not life-threatening. Second, it's a journey. These are very general concepts, but they should guide you. Yeah. The third is that imaging, MRIs, imaging, it is only, and I'll take words from Tracy Jackson, who did a good TED Talk that I've been conversing with. It's only part of your story. Yeah. And a picture.
I loved how you read your MRI and told it was you, but you had no pain. Like, that was just, it was brilliant. It's so true though. I'm sorry to interrupt. Go ahead.
No, that's okay. We need stories, and for people to start getting it. And the thing about an MRI, this is probably one of the most important things people can take away from this podcast. And I say this wholeheartedly, our entire medical profession, the MRIs, the imaging, we make money off of them, which of course at times it helps us. But the problem is, it's a static image. Yep. It's one picture. And most physicians are not trained on how your body moves. And like, we learn on a dead body, the anatomy.
Yep.
And there are people that are so good at understanding the musculoskeletal system and how the movement works and how it interacts with everything and how it's all basically all intertwined with everything else. And so it does no justice when it comes to the MRI if it's not a major red flag, unless you have a big Goomba, like pushing on your liver, your in your spine or whatnot.
Goomba means tumor.
Yeah, I made that up. That is not a medical term.
But we use it in medicine often.
Yeah. So the thing about all these imagings is that you have to, most people are musculoskeletal experts. If you go with most time it is musculoskeletal pain, not always, but that most of those people will not want to see an MRI right away, because they want to know, how are you functioning? What is it where's the deficits? Because if you just look at the numbers on my graphs in my book, you look at how many people with no pain have all the same things that people complain about as their cause, which could be, for some people. Right. But that's a huge takeaway.
And, I use my own MRI. So when I tore my ACL, so I tore my ACL December 14th of 2015. 2 days later, I had an MRI, and I had been having lower back pain for a long time. So I'm like, can I just go ahead and get my back scanned while I'm here? Sure enough, I had 2 herniated discs. So it just confirmed, like, okay, I've got some sort of pathology going on, but did I have surgery? Have I been on medicine? Did I get needles stuck in my back? No, and no. And how am I doing today? Awesome. And so much of my healing, I has been me understanding my own disease process, how natural ways to heal it without any medication, without and all ways that I used to think were woo-woo, just for the record.
Mm-hmm,
and so if you have, let's think about the train wreck pain patient who comes in and has been needing to see a doctor like you, and you have all the time in the world, which we know that that's just not a realistic approach. But that's the beauty of this pain book, the Paindemic. I really think that a person that has pain can read this book and be so empowered with so much knowledge that when they go to see a pain doc, they can be like, okay, more pinpointed and specific on, okay, this is what I've tried. This is my experience, and have them help the patient, or have the physician help the patient. But so the typical pain patient who has like 4 or 5 or more different medications that they're on, has been to multiple doctors, and all of them are, the either procedure minded or surgery minded or opioid minded. What's the first step for those people? Like, seriously, what do you do with those people? Where do you start?
It's still a challenge for anybody. I would say that if I had a clinic where I was actually officially doing this, I think you had to figure out who your team is. Mm-hmm. I think you had to figure out who your support is going to be.
Yeah.
Because you have to have a team that's willing to educate and go through meticulously through all of the information and data. And yes, that takes time. I think it depends what all those things are. I think if there's somebody that is, overweight and has pain and on opioids and has sleep apnea, and there are some real basic learning to get your sleep an ideal. First of all, if you don't have good sleep, I always feel like that's the basis for starting off the first day of your change of your life. Like, you pick your day, and when you pick your day the night before, you're getting a good night's sleep. Problem is, if you have pain or you're on opioids, that can mess with your sleep cycle all the way around.
Yeah.
So, if someone had sleep apnea, obviously you're not going to be able to get good sleep if you're constantly obstructing, and which is life-threatening, by the way, for those that are watching this. If it's moderate severe,
right.
And
for the listener who's listening, sleep apnea is basically where, and sometimes you can see this in thin patients, but for the most part, it is patients that are carrying extra weight, and they carry extra weight around their neck area. And when they get so relaxed that they fall asleep, their airway collapses. And so they oftentimes wake themselves up with snoring. So if you have a relative who always falls asleep on the couch and they wake up to this, that's an awful sound, right?
That was really cute.
But that's them obstructing and waking themselves up. So they create this awful sleep pattern that basically they never get restorative sleep. And that right there, like she said, that combined with opioids, that's where life-threatening.
Yeah. So that would be some of my first things. When it comes to someone who's diabetic, hypertensive, which, by the way, for those listening, anyone who has sleep apnea, the strain of the nervous system just fires up to kind of tense up your muscles so that you can suddenly breathe again. That stress on your heart and lungs. Mm-hmm. It advances heart disease. The type of inflammatory process that goes on every night of your life when you have that kind of, sleep apnea. And like you said, it's most of the time, majority of people, it's from carrying extra weight. Most people get midlife and they carry the extra weight.
Yep.
That's the time. But there are those that have a small chin or a real collapsible chin that are not very overweight, or a small chin, a recessed chin that falls back and kind of cuts off. There's other reasons too, but those are the predominant ones. But those are things that I would want addressed first and foremost.
Yeah.
Just because people need their sleep. People need to be able to heal. They need to be able to recover. So I would focus a lot on sleep and look at the medicines and how it can affect their sleep. And then from the opioid standpoint, I think those things should never, the thing I worry about with the opioid, people's emphasis, when I say paindemic, I don't mean just opioids. I think there's a time and a place, use them appropriately. But the problem is you're making so many physicians scared that they're retracting them, but you're not giving the skills to the physicians so they can provide the skills to the patients, and they don't have the time for it. So that's why you need a village of people, that team to help you. So
Absolutely.
you need to learn skills. I think therapists, especially musculoskeletal, and not all physical therapists are the same. So it's so hard to direct people, but you need to have a community where you have someone who's a good therapist, maybe someone who's McKinsey trained, and that doesn't mean just flexion extension exercises, but someone who's willing to kind of like figure out what the body's preferring or not preferring, and helping them understand their body better. And there's also Feldenkrais. There's all these other people that show you how to move, where if you look at your habits and your daily routines, how they could be contributing to your pain. Some people, they might have all these disc problems like you talked about, but even if they're pathological, they might have just tight tissue, and there might be ways, whether it's acupuncture or massage or general yoga, but you still have to understand your body and what it likes or doesn't like. You can hurt yourself doing yoga too.
Absolutely.
So really getting to understand someone who can help you with body awareness. And there's different things that I list in the book about that. Someone who's a therapist that can be strategic in how they strengthen and help you with your body.
Let me interrupt you. Is there like, cause I know, functionalmedicine.org is a great place. Is there a website that gives you options for physical therapists or movement therapists that are trained in this? You know of?
Well, McKinseyInternational.org is where the physical therapists kind of up their level of training.
Okay.
Just so you know, I've actually there's 4 major parts and there's additional parts after that, but I'm already taking part B on neck for McKinsey, what therapists take, just because I want to know what they know.
Yeah.
But McKinsey International, Feldenkrais, you can look up that easily. There's some evidence for that as well to help people with pain. Yoga, everything pretty much is either none to low to moderate for pain. So,
right.
Can you hear me?
Yeah.
Can you hear me okay? All right.
Yeah, now I can.
Yeah.
You cut out just a little bit. It's all good.
Yeah, so it's like mild to moderate evidence to pretty much on anything, but the whole point is you want to personalize it to that individual anyway. So the evidence is there to guide you. It's not there to be, the instructor. I have some things that I can give you to maybe list there.
We can put them in the show notes for sure.
Yeah, and that's what I'm developing. That the Pain Out Loud website is what I'm developing so that people can find those kind of resources.
Nice.
And interviews with people that do those various types of things. So I think it'll be a great resource to just give people a bird's eye view instead of the siphon view of see primary care doctor, go to pain doctor, go to surgeon. Like there's so much more out there. And not everyone's doing it because they want to make money. I think that's just all they know. Yeah. And so that's the way it is. And they don't want to get in trouble for not doing it to protect themselves.
Yep. No, I loved the analogy when you were talking, because the medicine as a business, and you were giving the analogy of spine surgeon, and you broke down the cost of everything. And I think so many people think that we, the doctors, are the reason why healthcare is so out of control. And you telling exactly how much the 2 physicians that were involved in that particular surgery made, it's I already knew it, obviously, but I think it will blow a lot of people's minds when they realize, like, and when you quoted the CEO, like one CEO's, I've literally almost vomited in my mouth. Yeah. Like if people only really knew and understood, and that like, I'm just curious because I'm conflicted. Do you think socialized medicine is the answer?
Not completely.
Yeah.
I think the intention of taking out the incentive for more procedures is good. I will say, I'm constantly trying to inundate myself with what's out there.
Yeah.
And for like people that have, I'm going a little tangent, but those that have weight problems or inflammatory type pain, or like what's called complex regional pain syndrome, which is like a really burning pain that can come after a trauma or other reasons. Those types of people that it's like, it doesn't seem totally musculoskeletal. I feel like those functional medicine doctors out there that are trying to take the middleman out and have cash only practices. I mean, I applaud them because, obviously not everyone's going to be able to afford that. And, but I really think if we could get back to the basics of the reason we're in this business and why we're trying to, help people, if we could just get down to taking care of the patient, having the patient value what you have to offer versus trying to convince the insurance company that you're of value to the patient, then those problems would dissipate. But the problem is it's hard to just convert the entire society to that. But I think it's a good start. I think functional medicine is, the intention is there where it's very rational, trying to find a root cause. Mm-hmm. But just like any field, you can take advantage of a population or overutilize something that maybe it's not necessarily that much. I think there's always a balancing of risks and benefits, but socialized medicine, it's got its problems too. And, if you need some other countries, I know I don't want to, I'm not an expert at all of the insurance situations, but I know I have a friend in Australia, and like they have this other, plan, or in Canada, you can have another plan that's private. So if you had to wait 2 years for your gallbladder would get taken out, like you could get it done sooner if you had your own higher insurance. So I don't think it's 100% the answer. I think there's some kind of hybrid in between. And if we just paid cash for non-emergent, truly emergent, I mean, of course there could be emergency and you were drunk and you got in a car accident, that's not good either.
Right. But but then you have the whole population of people that are in impoverished neighborhoods and families and they're left behind. I mean, there's so much conflict in my heart, and that's part of the reason why I got out of medicine. Cause it's, I mean, you and I could talk about this truly all day for sure.
That's why I don't do it full time.
Yeah.
I mean, I'm 4 days a week, but maybe 3 days one day.
Another part of the book that I really loved, which I wish that I would have had this when I was doing anesthesia in the pain clinic, but for my own understanding, because I knew that, more or less kind of what I thought, what the procedures were that I was putting patients to sleep. I knew that it was all about speed and how fast I could get them asleep and get them awake so that we could turn over, fast, obviously doing it safe. And I was still able to form relationships with these patients. But for the most part, I really didn't understand like the technical side of the procedures. And I love the part of the book where you talk about, the medial branch blocks and different things so that you can empower the patient who is about to have this procedure so that they have a basic generic understanding of what is about to happen. And, the reality of, okay, maybe I haven't done everything that I should have tried to get to this point. And just, it's all about empowering. Right. Now let me ask you this. What is your feel on the nutrition aspect of its influence on pain?
Oh, well, I think there's so many different ways it influences. I mean, you could just get someone to say, I'm going to get dehydrated and have a few drinks and I'm going to see what my joints feel like in the morning. Like that, you can just for your own, I'm not going to suggest to people to
for the record.
Right. But you can see how, little subtle things, a one-time situation, how it can impact you. And so it's not like it's easy to always prove that dehydration causes joint pain, but if you're not properly hydrated, there's these micronutrients that, that's what functional medicine doctors are great at checking too. More so than my understanding because they do that all the time.
Right.
But there's, basic, magnesium is, and a very important, for us to have. We have to have it. It's so many processes in the body that we need it.
And yet so many people are deficient in it.
Oh, yes. And you need calcium, in order to absorb certain things, you have to have, a combination of different factors. But the point about our nutrition and what we're eating and the inflammatory, just look at the omegas,
Oh, yeah.
3s being the anti-inflammatory, 6 being inflammatory. When you look at our diet,
it's 8 to 1. Yeah. 8 to 1.
Right. the sad diet.
Yeah.
Diet.
The standard American diet for those of you that are like, what's the sad diet? What am I missing? No, you're not missing anything.
It's so sad. It's so sad.
It's so sad.
It's so sad. But, and we all have it around us. So it's so convenient, and when we're stressed, that's the hard thing, is that when you're stressed, we tend to consume the diet that's not good for us, because as far as having just something in a vending machine just because it's there and you don't have time, or you're just trying to make the time go by faster. Everyone has different reasons for going to that, but if you plan ahead and you go for real food, not stuff that's boxed up, and go for things that actually have a lot of nutritional value, they're very nutrient dense. And I know you follow a lot of the guys out there, Dr. Hyman, and there's so many people out there doing a good work in trying to promote a healthier, lifestyle. Pollen, he's another one, but I'm forgetting his first name.
I don't remember his first name either.
Yeah, but lots of great content out there for people to just remember. But it doesn't have to be real complicated. People can just, if you get organic, but then it's what can you trust? It's tough in this day and age, but I think there's probably a lot of toxins that we're not capable of
totally eliminating. Yeah.
Right. So we're inundated by a very toxic environment, and obviously there's different ways our body is able to handle those toxins, and that's another reason functional medicine doctors are helpful. They at least have better knowledge than your traditional physician. So as far as how it affects pain, I think if it's a truly inflammatory pain, it's good. It's good for you regardless if you have pain or not. So, if you just want to get better sleep, feel more energy, take on the day better, it's just important. But I think there is a little bit excessive focus on inflammation all the time when we have pain. There's a lot of habitual things that we do that put a lot of strain on our body. That doesn't mean we necessarily have something we don't have a deficit of ibuprofen. It's
no, we do not.
We need to pay attention to what we're doing, and people don't understand, and I have to remind people that are close to me, well, I never had this problem before. I'm like, well, maybe you're 4 decades into doing the same thing over and over. There's a point where your body's like, okay, I've had enough.
Right.
This is too much. And so that's where you have to learn.
Or like the person that you addressed in the book of, you haven't done anything your whole life, and then you jump into, and I know you didn't say CrossFit, but I knew that's what you were thinking.
Well, it's one of many things.
It's true. But the person who just throws themselves into some sort of exercise regimen that's like, start with yoga, dude. Right?
Well, baby steps,
or just walking. Like you said, walking every day can make the biggest change.
Here
to start. Oh yeah, definitely.
Yeah.
Well, what about the patient who comes to you and is convinced that it's their genes and this is the way they are?
Oh, I have so many stories for that.
I know you do.
I won't go into all of them. Yeah. Well, the thing is, most of it is lifestyle. That's just the bottom line. Humans are really good at denial. I've been, all of us have done it at some point in our life.
Absolutely.
And it's a lot easier to just feel like, okay, it's just the way it's going to be. And the reality is our genetics are predispositions or susceptibilities. And your lifestyle will shove your susceptibility in one direction or the other. So if you're prone to diabetes, then, if I could tell you exactly how to spur it on right away.
Yeah.
It may
that sugar and refined carbohydrates.
Guaranteed.
Right. Yep.
Right. And then so many people don't realize the benefits of how this is something I'm always flabbergasted about patients that are diabetic and that don't understand the concept of working like 3 days a week on your muscles, doing some weight training. Yes. That your insulin, which just a little recap for everyone, comes through your pancreas, basically takes in the food you just had, which is broken down in little particles of glucose, and you takes the glucose and then puts it into the cells or the muscles, the places you need that food. Well, this is how my analogy goes. You might like this. So your insulin is your pizza delivery boy. And your glucose is your pizza. So you need the pizza delivery boy to take it to the house and shove that pizza in the house. Well, the cool thing about exercise, you can skip the pizza delivery boy and you can go through the back door and you don't have to use him. So
love it.
It's the greatest thing about exercise when you really actually power the muscles. The problem with most people that are type 2 diabetics is they're resistant to insulin. So it's like you've put like 3 major locks on your front door, and your pizza delivery boy, there's no way it's getting in. So it's got to have like 3 pizza delivery boys to finally shove that door open and get it in.
That is a great analogy. I will use that.
Yeah. I'm like, but why don't you just skip all that problem and just do the exercise? You decrease your insulin requirements, decrease the pizza delivery boy needs, and then you just get the glucose into the muscle cells. And by the way, the name of those receptors are, I don't know why I remember this random little tidbit, but it's called GLUT4, GLUT4, GLUT4 receptors. So use your glutes, to help you get the glucose into the cells. So anyway.
I vaguely remember that receptor name. It's been a long time.
Oh, yeah. And I brought it up with a endocrinologist at a meeting about a year ago. And I said, hey, this is how I describe it to people. What do you think about this? He's like, that's actually a good one.
Yeah.
So it was endocrinologist approved.
There we go.
So anyway, that was a tangent. I forgot where we're going.
Well, I asked you about genes and
yes. So exercise is huge. It turns on your enormous pharmacy of your body that you don't even have to understand it all. Just know that you are firing up a more efficient body that makes your brain function better, actually helps your brain from, shriveling up as you get older. Like that should just make you happy enough to do it.
You would think.
Yeah. Well, it's either pain now or pain later. So, if you don't use your body and exercise, then you're going to pay for it later. And
true.
And I could give you examples of tons of people in my family. And I think it was good that I was so big into sports and active, because I started recognizing how it's helped me here too. But
absolutely.
But genetics, genetics are not just, they're just a code, and how you translate that code of your genetic code is based on the lifestyle you lead. And there's a new area of medicine called Epigenetics that helps you understand how you actually influence, not just you, but any kids that you have down the road. It's pretty amazing. Even your longevity too, the length of the telomeres, how long, you can look into that, but essentially how long you live, the quality of life you live, and how you after you. So I don't ever buy it. And as far as the telomeres,
yeah.
Well, as far as the exercise and the telomeres and just the longevity, or how long you live and the quality of the life that you live, is, that exercise alone is one of many ways you can influence your genes. But the kind of food you eat is tremendously important. It's bad enough that we have to deal with toxins we can't see in this environment. Mm-hmm. So you've got to do the best you can, and no one's expecting you to be perfect, but you can't deny and just let things go. Right. Because your body will go downhill very fast. And I have living proof around me all the time.
Oh man, so true. So true.
And you can look at family members, the ones that took care of themselves, and the ones that don't. And it's really hard to watch. And when you do get morbidly obese, there's a graph in there. Not everyone is going to have pain just because they gain extra weight. But once you get to like BMI of 40, 50, it's close to 200% increased chance of pain. So, your joints are having to deal with gravity already, and you don't want to overly insult those joints either. So
when I was a fourth year med student, I was doing an ortho rotation because it was literally my last rotation before I graduated. So I took an easy one, and I heard that they were easy on fourth year med students. So I'm in with Dr. Chang. I don't know if you remember him, and he is one that basically. He just says it the way it is, and he's had plenty of patients leave his office crying. But I remember there was this morbidly obese Mexican patient who she had major knee pain, and he basically broke it down. He's like, okay, so how much do you weigh? I don't remember how much she weighed, but then he's like, okay, now how much should you weigh? Okay. So he goes, so that is, and he basically broke it down, like how much exponential weight is on that joint that is not meant to be. And of course she started crying, but the reality is, there's so many factors that go into pain, and the factors that we can control. I don't think a lot of patients aren't aware that they do have control. And I mean, just the SAD diet, the standard American diet. I mean, it's the reason why so many people are dealing with the problems of obesity and diabetes and hypertension and all of the inflammatory states that we see. I mean, there was a patient that I had in the pain clinic who had been diagnosed with rheumatoid arthritis years before, and I would refer certain books basically that dealt with nutrition. And I'll never forget when she came back, she was not one that was every 2 weeks. She came back, and literally when she saw me, she started crying. She was like, I wish I would have met someone like you back when I was in my 30s, and I would have known, because I made these changes and it was amazing to me how many people didn't take my recommendation and go and just empower themselves. But the few that did, there are more things that you can empower yourself with to overcome that pain. If not, at least just make it better, less severe. Maybe not goes away completely, but I do believe that there's a lot of people that are walking around with chronic pain that believe that they're going to be that way forever, that have full potential to reverse it and live a life without pain. But just having the belief that state of being pain-free is even available, I think a lot of people have lost.
Right. I was going to say that I think why it's so hard, and this is the dilemma of the human race, is that many of these things are so subtle. They're so insidious, and they creep up so slowly over time, even though pain might seem like it comes on overnight, that because those other things had existed before, whatever their habits and how they ate and all, it's not like, this is how I compare it. If I tell you to jump off a cliff, you'd say, hell no. I mean, in all honesty, because there's a direct correlation of a cause and effect, and it's a very bad one.
Yes.
But when it comes to something that doesn't necessarily happen in one instant, and it takes 20 to 30 years for it to eventually manifest into a symptom that you personally, as a human being, can recognize, that's a lot harder for people to understand. Until like even a friend of ours had a lot of asthma problems and carried a lot of weight. It was more of an apple type shape, not the typical pear woman shape. And so the way that the weight was carried was really pushing up on the lungs, really made it hard for expansion of those lungs. And so after finally cutting a lot of carbs and trying to eat real food and dropping like 50 pounds, she couldn't believe that her asthma was mild when it had been moderate to severe, know? And it could be not just the weight, but the kind of foods and maybe some dairy and other things that made things worse. Allergic type, algae prone foods. But anyway, that's just one thing I wanted to mention, because we have to be really honest with ourselves. And until you're ready to be honest with yourself, whether somebody gives you the I'm going to make you cry speech, like you said Dr. Chang did, or you just finally said, I'm fed up. But it all comes down to be honest with yourself, and in having a strong enough motivation to actually go forth with it. And you've got to make your mind ready for any changes that you're going to do. So that's why I always say that getting your sleep down and trying to, change your nutrition, those are the quickest ways I feel like you can optimize yourself. Take a walk, get a good night's sleep, and start off with the right kind of food in the morning, and just kind of devise a plan. But you got to set it off on the right foot.
Absolutely. So are there any takeaways that you want a person that's listening to this podcast that has no medical training, but experiences pain, any takeaways that you want that person to go home with?
I think the first thing you have to do is you can talk to somebody. You have a primary doctor, that's fine, but understand that their training is many times limited on what they can offer, and the sense of maybe offering drugs or maybe a referral to therapy, which might be a good place to start, I think, for a lot of people.
I think your explanation of evidence-based medicine and it's where it's lacking, I think it's beautiful, because it's true that there's a lot of methods that aren't evidence-based proven, but would be potential, God sent to a lot of patients.
Right. And it's really comes down to trying to understand. You'd have to find the right people to help you understand. And I can't tell people exactly who those people are going to be because each one's different. But it's for everything. Like, I know this is a horrible analogy, but if you had to go to the bathroom for like 4 hours, that would be pretty painful, but you get relief after you go to the bathroom. You take care of the problem. And you don't need a diagnosis for that pain. You don't need evidence-based medicine, and there's not going to be evidence-based medicine because there's no drive to do that.
Right.
But my point is that if you can try to correlate and try to understand what is leading to that pain, have someone guide you to help you understand that if it's not very clear, and be careful with the diagnosis that may not be accurate in the first place.
Right.
So always be open to trying to understand other things, especially if what they're suggesting and maybe what you've done, whether it's an injection or medicine, if it's not helping, you got to stop. You got to reevaluate yourself in your situation and get help in understanding if you're not medically savvy. So if you're not really, if you don't understand the terms, it's not fair for them to talk to you in a language you don't understand. Mm-mm. That's like, it's okay for me to talk to you in Spanish and you only know English.
Yep.
So I really just want to empower people to try to make some level of rational assessment of the situation. And that might mean a few different people. Primary doctor, go to a physical therapist, understand your body better, understand how it works better, because you've already proven that you're susceptible to this pain.
Yeah.
So it's very likely that you will probably have consistent pain, or it might come and go at times. But if you learn how to help yourself, you won't have to spend as much money. You won't have to go to as many people to deal with your issue. And sometimes we're wrong. Yeah. We may misguide you, but that's the whole point. You have to always constantly reassess. Mm-hmm. So I think people need to look at it as a journey and reassessment and reevaluation, and always participate in your care in the sense of doing ownership. You have to do things to help yourself. Use the medical system as a bridge. They're there to guide you. Amen. They're there to educate you and help you out when you can't help yourself.
Amen.
So that's my biggest takeaway. And you can follow the Pain Out Loud community that I'm just getting started. But
yeah, I was about to say, so if someone wants to find you on social media and online, where are they going to be looking?
Well, melissacady.com and challengedoctor.com will be the same site. Essentially goes the same place.
And remember, that's Cady, Cady.
That's why I did challengedoctor.com. So
smart. So smart.
Spell it out.
Yep.
Yeah, not DR, but Challenge Doctor spelled out. And then you can find everything I'm doing there. That's what I'm transitioning to. But Pain Out Loud will be accessible through there. But that is the community that's going to have better access to understanding all these things you asked me about, like, well, who does this, or what do they do? So hopefully I'll keep expanding the options so that people are not clueless.
And this, I'm going to show this for our YouTube watchers, that this is what the book looks like. I highly recommend it for non-physician and for physicians, especially like physicians that deal with pain patients. So, I mean, if you're an endocrinologist, maybe, but you could still, I'm sure you have patients that have pain that you could benefit from. So I love that it's written for the layperson, the non-medical person, but it's also helpful for medical people. Cause I mean, I'm a classic example. I'm an anesthesiologist who freaking worked in a pain clinic, and I learned a lot from reading the book. So it's a great book. And I truly, I have a feeling that this will not be the only interview that I have you on the podcast, because pain is something that's true. I mean, it's a pandemic. It is something that really can control a person's life and make them miserable. And like I always say, life is beautiful. It's a blessing. And if you are heavied by the burden of whatever your pain is going on, you can't really enjoy it to its fullest. And so it takes a family and a team of amazing people. So I'm going to show the book one more time for those people that are watching the YouTube channel, and it's called PAINDEMIC, PAINDEMIC, for those that are listening on the podcast. Melissa, Cady, D.O., you are awesome. Love you. You know that I'm a fan of yours. Thank you so very much for taking the time to talk to me today. And thank you for all of the help that you're going to give all the people that listen and watch this.
Oh, well, thank you, Lauren. And you're doing an amazing job trying to get a huge impact on the world. We need some healthier, happier people.
Amen. 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 All right. Thank you guys so much for listening to this episode of FITZandHealthy.com. If you want to go to FITZandHealthy.com/episode 8, you can find all of the show notes and find where you can find Dr. Cady and her book Paindemic. Thank you very much for listening. I'm out. Ciao. Make sure that you find us on social media. You can find Synthony on Instagram and Facebook at Synthony. So that's CINTHANIE, and on Snapchat at Synthony P. And find me on social media platforms like Instagram, Facebook, and Twitter, all at Club Fitz Fitness. Remember, that's FITZ Fitness. And on Snapchat, just at Club Fitz. I appreciate your time listening so much. If you enjoyed this episode of the Fitz and Healthy podcast, can you please go do me a favor and go subscribe at whatever platform that it is that you listen to podcasts. Leave a review. We read every single review, and we appreciate the time that you take to leave your thoughts and opinions. Now, also remember, while I am a medical doctor, the information I provide here is not intended to provide medical advice or a professional diagnosis, opinion, treatment, or services to you or to any other individual. I am providing general information for educational and informational purposes only, and it is not a substitute for medical or professional care. You should not use this information in place of a visit, call, consultation, or the advice of your physician or other healthcare provider. The information I share is not intended to treat, cure, or diagnose any disease or medical condition. If you believe you have a medical emergency, just call 911 immediately or your physician. Now, enough of that medical legal jargon. Thank you so much for listening to this podcast. I appreciate your time. Now, go live a Fitz and healthy life.